This is the biggest question, I think, out there, which is the distribution of this vaccine, having to get to 300 million Americans. I spoke to the person who's the head of distribution for Operation Warp Speed just yesterday, who said by the end of June, he expects every American who wants this vaccine will have access to this vaccine. How do you go about distributing this vaccine?
Yeah, Yasmin, it is going to be a major challenge. What the committee meeting today will do, we'll be talking about who should get this vaccine first, in what order and why. And over the past couple of weeks, this committee, it's called the Advisory Committee on Immunization Practices. And what they do, and they've been in existence for decades, they provide the recommendations to CDC regarding who should get an approved vaccine and why. This is true for the childhood vaccinations I give as a pediatrician. It's true for the seasonal flu vaccines, and it will be true here. In all likelihood, they will recommend that healthcare workers, frontline healthcare workers, be in that first group. And there are many reasons for that. They have a great risk of exposure, and we look to them to be able to provide the care, as you were just showing at the field hospital, the care around this nation for people who become sick. After that, it will be groups who are at increased risk of having a really bad outcome with COVID. And we'll have to see, how they rank the priority for elderly individuals, people with chronic conditions, other essential workers. These are all groups who are at increased risk. And as we've been talking about through this pandemic, you have to look at issues of equity. Black Americans, Latino Americans, Native Americans have been getting infected, hospitalized, and dying at rates that far surpass their proportion of the population. So that is something as well that will be considered by the committee and make sure that issues of equity are dealt with and are front and center.
So you brought up a couple of really good points here. First, how do you identify which healthcare workers actually get this vaccine? Because it's not going to be able to get to all those frontline healthcare workers. Who's most important, I guess, is the major question. How do you identify that?
Well, part of it, Yasmin, is that when you look at the surveys of who wants this vaccine, there's a lot of work that has to be done around trust. I'm going to be watching, in addition to the CDC committee that's meeting today, next week and the week after, the FDA and the FDA advisory committees are going to be meeting. But for vaccines to have the uptake that we're looking for, we're going to need to believe that the process that FDA is using and their advisory committee are true, that they haven't been tampered with for political reasons. So, I'm withholding judgment until then. To date, all we've had is reports from companies themselves in terms of how effective these vaccines are and how safe they are. I am very optimistic that they will be safe and effective, but I'll be looking to these committees and see, do they have any concerns? Is their endorsement very strong for this? So that when vaccines are approved, we can say, yes, this is something that you should get. Then within healthcare, the CDC will put out the recommendations. They have always had systems in place for distributing to states. And then within states, the state health departments then look to see, okay, here are the points of distribution. Each of these vaccines has different challenges in terms of temperature and storage, tracking of individuals, since these are not one-dose vaccinations. Each vaccine, both the Moderna and the Pfizer vaccine, require 2 doses. One is 4 weeks apart, one is 3 weeks apart. You have to be able to track people to make sure that they get the same vaccine both times and at the right time interval. Lots of logistics here, but states have been working on this for many months, knowing that vaccines likely would be coming by the end of the year.
What about rural communities? That's a real concern, right? You talk about the Pfizer vaccine. They need to have a deep freeze environment to keep that Pfizer vaccine. They need double doses. What is the plan to get this vaccine to folks that are living in these rural communities?
Yeah, I mean, that's a real challenge. And if you think globally, we're talking about in the U.S. that we have 300 million people that we want to get vaccinated. Globally, we're talking 7-8 billion people, and many people who live in rural areas where it will not be possible to maintain that cold chain. As we're thinking here, Pfizer, as they've talked about this, said they have developed the technology and containers to contain dry ice that will keep the vaccine to the proper level. But this is something that states are looking at and figuring out, okay, how do we do this? Do we bring vaccine to people, or do we bring people to vaccine? How do you weigh the benefits of having centralized distribution points for administering vaccines with the needs of people who are in rural areas? And as well, as hospitals and healthcare workers are stretched caring for people with COVID, how do you think about pulling some of those people away from providing direct care to be able to provide immunization? Some of this is the same workers who do both, and it's going to be very challenging if we're not able to get the numbers down that are on the rise around the nation in terms of hospitalizations and overall numbers of cases.
Dr. Besser, real quick, final question here. How do you take politics out of the vaccine distribution process?
It's a real challenge, but the last thing you want to see is someone's accessibility to vaccine be based on their income, the color of their skin, their political or social connections. We have to have a system that is truly transparent so that those who are truly the most at need, those who are providing services and working as essential workers and healthcare workers are getting this first. And that's a system that we believe is truly fair.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.